because prevention is one of our strategic priorities, we have been working on developing a framework of what we actually mean by prevention. And a few of you have seen this because we have been trying to bounce ideas off of you of how do we define better what we mean by prevention when we talk about the definition of child protection, which is prevention and response to abuse, neglect, exploitation, and violence against children. The prevention part, a lot of the time, gets dropped because it's a rapid onset emergency or resources are scarce and we're firefighting. We're trying to get to the most affected children, try to make sure that we provide them with services. We forget about this machinery that is still producing the adversity that we are seeing. There is still the root causes of the child being separated or child ending up in child labor is still there. We're not addressing it because we just don't have the time. We don't have the resources. Donors are reluctant to fund prevention in the sense of when you talk about addressing root causes, because it's hard to prove that you have actually prevented separations. The most we have been doing, and actually some of the donors consider, for example, CFS funding as prevention, and it is to a certain extent preventative. Some of the work that people have been doing in CFS, and we know that now the evidence suggests that might not have even been that effective, but that's the extent of it most of the time. Then we have the whole violence agenda, which is, so those of you who are familiar with violence against children agenda, it does have a very strong preventative component, and part of it is because of the WHO influence into it, because they look at it from a public health perspective. And that has also informed some of our thinking. What do we mean by preventative approaches? Preventative approaches are primarily designed to prevent harm to children. They address root causes of harm. So when we say primarily, that's the kind of the key term. It doesn't mean that if you're doing a program to respond, you can't be also preventing. You of course are also preventing, but your program may not be primarily designed for prevention. It might be primarily designed for response. And the flip side of it is the responsive approaches are primarily designed to respond to needs of children who have already been harmed and those most vulnerable. But then in the process, you also are doing prevention. But we consider these to completely complementary. We don't think they can work towards well-being of children in silos or separately from each other. Another definition that I want to get into is, what is the difference between primary and secondary prevention? Primary prevention is when you address root causes of a condition. So, for example, in health, it's very well known that when you do vaccination, you're doing primary prevention. Where if you address smoking in a population, you're doing primary prevention. But when you go to a doctor, and the doctor, so you're already having a condition. You have chest problems, just like I do now. So you have wheezing, you go to the doctor, and the doctor addresses your immediate need, but also prescribe certain things for long term. Maybe they will ask you to smoke less, or exercise, or maybe medication. But it's towards preventing further harm to you. That's a secondary prevention. Now, bring it to child protection. In child protection, if we determine that the reason that children are getting separated or being put in child labor or are psychosocially distressed is X, Y, and Z, poverty, it could be poverty, it could be landmines, it could be anything that is the source of, or children are not going to school because of landmines. If you address those root causes, you're doing primary prevention. But if you're addressing the needs of the child that is already separated, and you're reunifying that child, but you're also going to work with the family that you're reunifying the child with to prevent another separation. That's secondary prevention, right? So, and I think it's an important differentiation because sometimes when you talk about prevention and response as if they're two different things, there's always a response that, but we also do prevention in case management, for example, which is primarily a responsive approach, which is true, but you're doing secondary prevention, which is equally important, but I think conceptually it's important to separate them. So this is basically to suggest that if you're talking about the child protection system, these two are two of the, again, there's a lot of components to child protection system. You have seen different graphs and visualizations of it, but this is focusing on prevention and response. So there's definitely overlap between the two, which is where secondary prevention happens. But there's also a lot of activities that you can do that are primarily preventative, and a lot of activities that you can do that are primarily responsive. And here we talk about community-based child protection, for example. Does it do response as well? Yes, of course it does response. A functioning child protection mechanism should be able to identify cases that require response, either refer them or try to help the community or the families to respond to the needs of the child. But the primary objective of it falls more on the preventative side, and we're talking about primary prevention. Family strengthening, the same thing. The primary objective of a family strengthening program is on strengthening the family so that the child doesn't get separated, doesn't go into child labor. And it happens, one of the key differences between these two is that preventative approaches often happen at the population level, meaning you don't target necessarily a single child, and responsive approaches often happen at the individual level. So if you're working with the family of an unaccompanied child that you have reunified, so you reunify Ali with the family that he used to be with, either direct parents or caregivers, and you start doing family strengthening with that particular family to prevent potential future separation. Is that a preventative approach or not? Secondary prevention? Yes. But what is your unit of analysis, or what unit of work here? What is your entry point to that, to Ali and Ali's family? It's the child. It's Ali, even though you're working with a family, right? Now, take a different type of family strengthening program. You go into a community that is affected by typhoon or war, and you develop a family strengthening program because you identify that children are getting separated very frequently, or children end up in child labor, or children are psychosocially distressed in this community. You work with all of the families in that community to prevent children going into child labor, prevent children becoming separated or psychosocially distressed. What is the entry point to that? It's the population, right? You're not targeting an individual child. You're doing a preventative approach that addresses the root cause, which you have identified as being families are not functioning as a protective environment. So there's no, in the process, you may identify individual children that you refer to case management, but your unit of intervention is the population. And of course, you have all of the, you address almost all of the child protection issues that we talk about on both of the spheres, but it depends on what is your entry point. Is it an individual level, which falls more on the right side, with overlap with the preventative side, or is it more at the population level? Are you targeting a whole refugee camp to reduce the chance of children being recruited, or are you identifying specific children that you think are radicalized? Is a very different approach. I put the quotation mark, and I saw a few head nods. So it is a terrible term to use, but for lack of a better term. And a lot of our interventions, the more typical interventions that we talk about, are built around or leaning more towards the right side of this diagram. So FTR is a very typical example. It's one of the most developed programmatic approaches. It's probably the mother of child protection in a sense that it was one of the very clear, well-defined interventions that we have been doing since a few decades now. But even the other ones, a lot of them are primarily designed to talk about the individual case that gets harmed, and then you intervene, you address the immediate needs. If you're doing your job well, then you also think about the longer term, and you do secondary prevention in those programs. But on this side, we're still developing much more than, I mean, we're developing on both sides, but much more on the left side, on the preventative side. And of course, both of these sides also interact with the other sectors. And I think that's when the connection with the rest of the sectors comes in, that when you're doing preventative work, you have absolutely no choice but work with other sectors. Because you cannot address root causes that are not squarely defined as child protection if the root cause is livelihood. Child protection is not going to be, child protection can identify that as a root cause and advocate for it to be addressed. Child protection is not the one that is going to be providing livelihood. It's another sector. So you basically, on the right side, I would say, unfortunately, we can work without talking to anyone else. It's not very effective, but we can. On the left side, you basically can't. Because if the root cause is that there's no school around, and that's why children are not going to school, and that's why they get injured more often because they play in unsafe areas, or they end up in child labor because there's no school to go to, so they want to occupy themselves. You have to work with education to solve that. You can't solve it. You can't build, or in theory, you're not supposed to build a school to solve that root cause of children going into child labor. So on the left side, we have absolutely no choice to work with other sectors. On the right side, we should work with other sectors in terms of referrals, but sometimes we don't do enough. And in terms of specialization, you're gonna see that the right side, you will see more specialization, and the right side is why specialization should remain. We will, even when we talk about integrated programming, we mentioned it several times during the past 2 days, we will never suggest that anyone else from any other sector should be doing FTR or a DDR program, running a DDR program. It's a specialized child protection intervention. Whereas on the left side, a lot of different sectors can be part of and core competencies that you need for doing preventative work exist along a lot of the different sectors. So you may call it a less specialized. It requires a less specialized workforce, even though it's a very important part of our work. And that's why it's actually very cost effective, because you don't need highly specialized individuals to be able to do it. You may need highly specialized individuals to design it, but to actually deliver it is not as specialized as case management is, or working with children associated with armed forces and groups. And the second part of it being cost effective is that it becomes, as the child moves along the axis of adversity and becomes more and more vulnerable, it becomes more expensive, of course, both in terms of human cost and financial cost, to address the issues.